Hello everyone. This video is about the different grades of dehydration and how we can treat them. Dehydration can be divided into three grades: mild, moderate, and severe. And these three grades can be differentiated on the basis of a few features. The first one is general appearance of the child. In mild dehydration, the child will be irritable and the child will be thirsty. In moderate dehydration, the child will be irritable and will be very thirsty, which means he will drink a lot of water. But in severe dehydration, the child will become lethargic and the child will drink very poorly. He will not drink that much water. So, if a child with diarrhea is not drinking that much water, it might mean that it's because he is lethargic and severely dehydrated. If you check the anterior fontanelle in mildly dehydrated children, it will be more or less normal. Whereas in moderate dehydration, the anterior fontanelle will be a little depressed and sunken. In severe dehydration, the fontanelle will be very depressed. Eyes are normal in a mildly dehydrated child, whereas in moderate and severe dehydration, they are sunken inside. The tongue will appear wet in a mildly dehydrated child, a little dry in moderate dehydration, and very dry in severe dehydration. One of the most important tests to assess the grade of dehydration is skin pinch. When the skin of the abdomen is pinched in a mildly dehydrated child, the skin pinch will go back instantly. It will be prolonged, which means it will go back slowly in moderate dehydration and very slowly in severe dehydration. The pulse is more or less normal in mild dehydration, whereas in moderate dehydration, it is fast and feeble, and in severe dehydration, it is weak and thready. The urine output in mild dehydration will again be more or less normal, whereas in moderate dehydration, the urine will be very dark in color. In severe dehydration, there is scanty urine. So, if you summarize all of these grades, in mild dehydration, the child will be more or less normal. He will be a little irritable and thirsty, but most features like the fontanelles, the eyes, the tongue, pulse, and urine are normal, and skin pinch will go back instantly. Whereas in moderate dehydration, the child will be irritable and very thirsty, anterior fontanelle will be depressed, eyes will be sunken, tongue is dry, skin pinch goes back slowly, pulse is fast and feeble, and the urine is dark. But in severe dehydration, the child will not drink water at all. The child will be lethargic. Anterior fontanelle will be very depressed. Eyes are again sunken. The tongue is very dry. Skin pinch goes back very slowly. Urine output is very scanty. And pulse is weak and thready. The treatment of each of these grades is different. So we have to first assess the grade of dehydration before treating them. Usually, the most common cause of dehydration is diarrhea in children. So, for mild dehydration, ORS is given, and this is given as 5 to 10 ml of ORS per kg body weight of the child for every stool that the child has. So, let's say, for example, that the child has had 3 to 4 loose stools. This value will be multiplied, that is 5 to 10 will be multiplied by the body weight of the child and multiplied by 3 to 4. That is whatever number of stools the child has had. In moderate dehydration, we give fluids, specifically ringer lactate in 5% dextrose. And this is given at a rate of 75 ml per kg for 4 hours. That is, this much amount of fluids should be given in a period of 4 hours. For severe dehydration, you have to remember a specific protocol. Again, fluids are given, which is ringer lactate in 5% dextrose, and they are given at 100 ml per kg. Now, this 100 ml is divided into 30 and 70. If the child's age is less than 1 year, the first 30 ml is given in the first hour, and the next 70 ml is given in the next 5 hours, which means that 100 ml is given in 6 hours of time. Whereas if the child's age is more than 1 year, the first 30 ml will be given in the first half hour, and the next 70 ml will be given in the next 2.5 hours, which brings the total time to 3 hours.